Heads of State and Government, Director General of the World Health Organization, dear Dr. Tedros, ladies and gentlemen, ambassadors, dear friends, 5 years ago, mankind had to endure one of the biggest upheavals of our century, facing the COVID-19 pandemic. Together, we managed to hold the line. Together, we managed to find solutions, including, of course, vaccines, and together we invented new rules, whether it was on the sharing of intellectual property or to speed up industrial processes. In so doing, we demonstrated that multilateralism is not an empty concept, but the best and most effective way of protecting our people. This is something we still know in the face of new threats such as mpox, cholera, and all the various wars and conflicts underway around the world, their victims and those who continue, even in very difficult situations, to continue to try and protect and treat them. I must, at this stage, thank most warmly the humanitarian specialists who are doing this work. Today, however, we have made a historic step forward, an agreement, a pandemic agreement, which was negotiated for 3 years and which is now a victory for our people who will be better protected against future pandemics. France worked tirelessly and will continue to do so to promote the values enshrined in that treaty. We will be able to make a more effective and equitable response to pandemics, treating everyone in the same way. You cannot eradicate a pandemic if you leave one area anywhere untreated, and this we need to remember in the next pandemic. We also need more effective and transparent warning systems than we had at the time of COVID, and bring together the concepts of equity and efficacy. We need to act as quickly as possible, yes, but we also need to spread the innovations we've made more quickly, because those two things are inseparable. We understand now the need to better share scientific information and develop tests, vaccines, and treatments, and do so quickly. This is a sine qua non for our collective security and safety. There's another thing that I have to say here today, at a time when some people think we can do without science and throw research overboard. Not only would that damage the health of all of us, but it would particularly constitute a threat to those who put these theories forward. They will be the first ones at risk when a new pathogen arises and we have nothing to fight it with. Our first line of defense is the WHO. Its standard-setting work, agreements such as the one we've just agreed, these will be a shield to protect us from the diseases which will come in the future. To all those researchers who want to freely continue to do their work, I would like to repeat here and now something that we already heard from the European Commission. We will be happy to welcome you in Europe because that will be good for Europe, for medical research, for you and for everyone. It's not a question of if we will have a new pandemic, it's a question of when we'll have it. And now with this treaty, we have a valuable tool along with our policy of One World for Health. We'll be able to better protect human health, animal health, and the health of our environment. And those three things go together. We are working still very specifically as well on issues which affect our people on a day-to-day basis, such as epidemics of chikungunya or dengue, which are currently affecting several French territories. I think of pollution of the air, pollution of water by things such as microplastics. We still have to work hard on these things. On the One World for Health Day, we will be meeting in Lyon for One Health Summit, which we hope will enable us to make solid progress with governments and parties from the private sector acting together in a spirit of goodwill. The COVID pandemic taught us one very, very valuable lesson above all the others, and that is you can't do anything without nurses, doctors, and medical staff. That means providing them with proper working conditions, a decent salary, and dealing with the distortions which have been caused globally by the emigration to other countries of staff in countries which already have a shortage. We need to provide better sustained training to medical staff and humanitarian workers, not in our own countries, but everywhere around the world. On this agreement, one final point. This will help us to increase the production of medical products needed to save lives during a pandemic around the world. France has been pushing this alongside you, Dr. Tedros, for many, many years. For example, in the RN messenger production hub in South Africa, which is now working with dozens of other countries. I'm also thinking of the vaccine accelerator in Africa, which has a budget of $1 million and which we launched with Gavi in Paris some time ago. This agreement also signals a victory of multilateralism over divergence and fragmentation, a victory of determination over indifference. It proves what we all know, that human lives should prevail over other narrow-minded interests. Thank you to all of you who fought so hard to get this agreement, especially those who chaired the INB from France and South Africa. In adopting this agreement, we are doing so because we strongly believe that protecting people's health means also protecting peace, security, the stability of our planet and our countries in the future. Ladies and gentlemen, Dr. Tedros, you may rely on strong support from France as we continue to reform and overhaul our World Health Organization so that it can emerge stronger and better equipped to tackle tomorrow's challenges. Thank you very, very much from me for all that has been done to bring this treaty about, and I hope that continues in the